As an academic medical center, Robert Wood Johnson University Hospital provides patients with the highest levels of quality care, and we continue to provide that care today. Since 7 a.m. Friday morning, we successfully activated nearly 1,000 replacement nurses across all units and procedural areas. I am proud to say that we are providing seamless care for our patients and their families. We are extremely pleased with the professionalism, skill, and compassion of these nurses. They share our commitment to support the hospital and our patients and our communities. The hospital is fully open and operational, and we are completely staffed. Always, safe staffing is our guiding principle for patient care. Safety together is the mantra at our hospital and across the RWJBarnabas health system. RWJUH operates at the highest nurse staffing levels in the state of New Jersey. We are a comprehensive cancer center and a level 1 trauma center. We have cardiac surgery and neurosurgery programs and a nationally ranked children's hospital. We must staff to both acuity and volume every day. In fact, the standards outlined in the recently proposed staffing legislation in Trenton are significantly lower than what we already deploy at this hospital. Allow me to leave you with some additional thoughts and data that we believe reflect our commitment to our nurses and our patients. We want to reach an agreement with our RWJUH nurses around our shared values. Together, we must recruit and retain top nursing talent to our magnet hospital. We want RWJUH to be the best place to receive and deliver care. Since May 2022, RWJUH has added more than 200 full-time RN positions. Hospitals across the nation are struggling with vacancy rates of 16% on average. We have worked hard to cut our rate to below 10%, and we want it even lower. Always, safe staffing is our priority, now and in the future.
The physician leaders and faculty at Robert Wood Johnson University Hospital and Rutgers Robert Wood Johnson Medical School have set the standard of care across our clinical services. We intimately understand the important role our nurses play in meeting the quality metrics we have established that directly affect our patients' outcomes. Simply put, if we do not have enough nurses, we cannot deliver the complex, high acuity care that our institution is known for. We cannot save lives. During the strike, we have brought in nearly 1,000 highly skilled nurses from across the country to continue to provide the highest level of patient care. The medical staff has been very impressed with their professionalism and knowledge. Moving forward together, our obligation now and always to our communities is to ensure they continue to receive this level of care by optimizing all factors that drive the best outcomes. Nurse staffing guidelines are critical to achieve this end. The proposals put forth by the hospital are appropriate to achieve these goals. Thank you.